findings from these registries could have an impact. So we looked at relative survival of chronic myeloid leukemia patients. And we saw that the very old patients, 75 years or older, they had an 18% relative survival, which is very low. So we went back and looked at this all through the regions of Sweden and saw that the reason was that they were not exposed to TKIs. They didn't get Gleevec or imatinib and so forth. So that changed then. So now the relative survival is like 0.8 or 0.7. And another thing was in acute myeloid leukemia, we saw that 2 out of 6 regions had worse results than the others in treating patients above 70 years of age with AML. And the reason was that they had a very nihilistic attitude. They didn't give induction treatment. And then that was known and corrected, and now all regions are at the same level. So I mean, there are things like that. And you can also use these registries to do more, let's say, molecular epidemiology. So there was a question whether hydroxyurea is leukemogenic, causes leukemia, AML or MDS in patients with myeloproliferative neoplasms. So we could take a large series of MPN patients, cross-match them with the cancer registry, find the patients who have developed AML or MDS, found a twice as big control group with MPN patients who did not, sent 2 ladies out for 2 years in Sweden looking at all the medical records, what was the exposure of all these. And the final answer was that hydroxyurea is probably not leukemogenic.